Welcome to the Asia Impact webinar series. In partnership with the South China Morning Post, the Milken Institute is tapping into our unique ability to convene senior leaders across sectors, and we're hosting a webinar series on global conversations about Asia. The Asia Impact webinar series will focus on critical issues shaping the future of the Asia-Pacific region. I'm delighted to introduce you to our partner, the CEO of the South China Morning Post, Gary Liu.
As the world continues to grapple with the pandemic, the experience of many Asian countries in recovery could well be a guide on how the globe resumes social and economic activities safely and with innovation. The SCMP is pleased to collaborate with the Milken Institute in bringing you these important explorations on how Asia is defining a new normal, creating safer, more resilient, and more connected systems for the post-COVID world. We trust that you will benefit from the expert insights in today's webinar.
Thank you. Good morning, everyone. Thank you for joining this webinar. The COVID-19 pandemic has been spreading across the world. It has created a healthcare crisis. So according to the data from WHO, COVID-19 has affected more than 200 countries and regions with over 60 million confirmed cases. So in this 45 minutes webinar, we want to take a look at the changes in the healthcare system amid the COVID-19 crisis, and we will discuss the challenges and opportunities lying ahead. This morning, we are very happy to have 4 experts joining this webinar to share their views on this issue. If you have any questions, please drop them in the chat box. Let's restart with Donald. Dr. Donald Lee is the president of the World Organization of Family Doctors. The COVID-19 crisis exposed the major shortcomings in the primary care system. So what is your sharing?
Good morning, everybody. It's indeed a pleasure and a privilege to be able to share some thoughts with you and join this distinguished panel. Okay, one of the major flaws in primary care systems in handling the COVID-19 is the neglect of the importance and value of family doctors working with members of primary healthcare team during the initial phases of the pandemic. One must not forget that local action is vital. Community engagement is the first line of defense in the battle against infectious diseases. Family doctors and general practitioners are both gatekeepers and health promoters by empowering the community to build a firewall against the deadly virus. Family doctors play a vital role as part of primary healthcare team because they are a trusted member of the community and the front line of health systems. Family doctors have been underused in risk assessment, emergency prevention, as well as preparedness. For example, risk communications is often seen as the job of public health professionals. There needs to be an integration of public health and primary care. Likewise, in response, family doctors can help block the viral transmission by monitoring people at designated checkpoints. They can slow the increase of cases by treating patients and providing medical surveillance in the community. Most cases were sent immediately to hospitals without proper triage and primary care. Family doctors were also not recognized for their important role during recovery or rehabilitation. They can take care of the clinical and psychological well-being of patients and extend that to their families so that the whole community can return to normal life as soon as practical and reducing exacerbations of chronic diseases. Primary healthcare saw and sees success in the adaptability and flexibility of family doctors as a member of the primary healthcare team in place where their role is identified and utilized. The comprehensive training of the specialty allows family doctors to serve in any aspect of the health system and adapt to where they are needed. Actually, the world has seen family doctors practicing at many levels during this pandemic, from the ambulatory care clinics to emergency rooms, even labor and delivery and intensive care settings. That's my brief view. Thank you.
Thank you. So now we notice more people focus on the primary care system amid this COVID-19. Let's address the question to Roberta. Roberta Lipson is the founder of United Family Hospitals and also the CEO of New Frontier. So Roberta, you set up the United Family Hospitals in China in 1994. So you have witnessed the development and improvement of China's healthcare system. Can you share more about that? And also, how does your company play a role in the COVID-19 crisis? Roberta, you have not yet unmuted the mic.
Thank you very much and good morning. Just speaking about the role of private healthcare in the development of China's healthcare system, as well as in the recent pandemic. It's interesting to note that private hospitals have gone from being very marginal players in China to now having more than 50% more private hospitals than public hospitals in China. Originally, private hospitals took care of people who were outside of the social safety net or who could not afford or get access to the public system. When we opened our first hospital in 1997, we introduced a new model of premium service care. And now with 7 hospitals and 14 clinics throughout China, we have seen private healthcare becoming increasingly the choice for the growing middle and affluent classes, who now also have access to an increasing array of commercial health insurance products. But during this time, along with the increasing impact and influence and participation of private healthcare, we've also seen the public system make huge strides and progress, and including using the learnings over time from various crises that China has faced in public health and getting better with time. So having been through the SARS epidemic and also bird flu, we've watched how not only the government has made great strides in dealing with those kinds of crises, but also how the public and individuals in the public have benefited from their learnings of how to participate as citizens in combating the epidemic. So I'm very pleased to say that we've seen a very different reaction from the government this time with COVID-19 than during SARS. And we've seen a very quick rise to action in calling upon the private sector, as well as all of the healthcare providers, to follow the changing recognition of the right thing to do at the right moment. And I have to say that it's been very, very encouraging. China's obviously done great things to bring the epidemic under control.
So do you see, do you have any enough information provided by the government?
Yes, I must say that right from, well, at least right from mid-January, starting in mid-January, we have had directives by the government on a daily basis, changing with the new learnings as the epidemic progressed. We have, till this day, almost daily inspections in every one of our facilities. So early on, for example, the Beijing government came to us and said, great, we think that you did a great job in your infection control in your hospital, starting from early days and using the learnings of SARS, but we're a little bit concerned that you might have more pressure on the system from this time around, so please enlarge your fever screening clinic. So we took 2 days to do that, and the government wanted to make sure that we were ready for what was coming at us, and continues till now to encourage us to increase our screening capabilities, has encouraged us to implement our own RNA in-hospital testing so we don't have to send samples out to an outside lab, and we can turn around samples, for example, within a day for patients that come to us for testing. So yes, the government has given us great support And I think that to Dr. Lee's point about the importance of incorporating the primary care network into the whole epidemic response is super important. And now with China, where there's a very integrated, at least locally integrated public system, and increasing numbers of private hospitals outside of the system, and many, many more, maybe an explosive number of clinics outside of the system. I think one of the learnings for the future going forward is to make sure that in every country that we incorporate the crisis response plan, we incorporate every part of the healthcare system, including the community-based, primary care, hospitals. I think that's really essentially important.
Yeah, thank you. Yeah, I think not only in China, but the healthcare system in Asia has been changing. So Jeff is the CTO of Fullerton Health. It is a healthcare platform in Singapore. So your company has launched a free symptom tracker in Singapore. So can you tell us more about that, and why did your company have such plan?
Great. Thank you, Peggy. So as Peggy mentioned, I'm the Group Chief Innovation Officer for Fullerton. My role here is really to rethink about how we can leverage technology, how we can leverage internet digitalization to make healthcare more effective, efficient, and make the service, the whole patient journey better. And so when you look into the whole COVID-19, when it first started, before it kind of hit the regional, I guess most of Asia, I think there was a lot of, I wouldn't say false information, but a lot of information online that people can search. And it got to a point where people just wasn't sure what's right, what's wrong. And so for us, and we also were seeing a trend of, because of it getting worse and worse, people didn't want to come to our primary care clinic because they were afraid of whether they might, if they don't have anything, whether they may catch something. And so it become, you know, we've seen the demand of how can I have a pretty secure or confident place where I can find out information or do a symptom check on myself to get a sense of whether I potentially should see the next step. And so we introduced the COVID symptom checker. And I think what's unique about what we introduced versus what's really out there, I think, is that integration of the online to offline. So what you see is, instead of just a symptom checker that you can use online, and then it gives you, a certain information of potential you might have or may not, and then you have to go to find out your own next step of where do I go find a doctor to do the next step of the care process. Because we have over 10,000 clinic, 20,000 doctors, we can connect you directly online with the doctor first, and as needed, you can go to one of our primary care. So in terms of the whole seamless journey of the patient as well as data, it is all integrated from both online to offline. So we have launched this in Singapore. We have also launched this in over 4 other countries. So we're in Philippines, we're in Indonesia, Malaysia as well, so that we are making sure that the general public have the access. So bring the power of healthcare really back to the general public, so they have the access to really protect themselves as well as understand their needs, especially relating to COVID.
Mm-hmm. So how is the response?
No, response has been great. I mean, if you look at in terms of the take up, or it might be even easier. If you look at since May in Singapore, our telemedicine take-up rate has increased by 10 times since May. So I think there is I always like to say, if you look at a place like Singapore or some of the more advanced countries, or even Hong Kong, for example, where I live, telemedicine, if you ask someone in end of 2019, when if you ask the client, and we work with enterprise clients, so if you ask some of the enterprise, when would you like to have telemedicine? A lot of them would tell you, we would love it at some point, maybe 12 months out or a bit later. And then when COVID hit, it was all of a sudden, we need telemedicine today. And so I think there's a huge change in user behavior in terms of take up, in terms of acceptability from both users as well as a service provider, which is the doctors.
Let's go to Grace. Grace Park is the co-founder of the Doctor, the world's first patient intelligence company. So what are the problems in the healthcare system today? Does it work efficiently?
With the average global medical inflation rate at 3 times the general inflation rates and only growing, I think it's a clear indication that our health system is not efficient. I think we could do a lot better. If we look at some of the root issues, we find that market forces are not working. Primarily, one is the lack of transparency. Patients are unable to make data-informed decisions about their care. They lack any metrics to determine quality. If we drill down even further into health data, for instance, one, it's not portable. Patients need access to their data at all levels of care, whether it's at the hospital, local, clinic, whatnot. And secondly is that health data is not consumable, meaning that patients need help finding the right specialists by quantitative and not qualitative means. And we need to harness the data to improve health outcomes and reduce medical inflation. And thirdly, I would say about health data, it's highly fragmented. So health systems operate in information vacuums and data silos, such as the infrastructure is quite fragmented. So to be a little more optimistic, I believe that what we need to do is take a fresh look at health systems based on the patient journey, redesigning it and reimagining from this perspective of the patient today in the digital age. It's not about trying and migrating analog systems into the internet, but to start fresh and build new workflows from the ground up, which puts the patient's needs first.
Okay, yeah, thank you. So in the past 6 to 7 months, we saw that digitalization has been playing a key role in this crisis. Jeff, do you think that telemedicine can be a COVID-19 game changer? And what is the blueprint of the healthcare system in the future?
No, I believe so. So my experience prior to Fullerton, I was the Chief Strategy Officer at WeDoctor. So obviously WeDoctor as an early adopter in China in terms of online healthcare. But I think sometimes right timing is very important. You see for many years, telemedicine, there was some adoption, but there was never really a monetizable, I would say, in a big way type of business. And maybe it's because of the payer system in China is quite unique, as Roberta has mentioned. But what you see now is really people realize that there are a lot of things that, especially because of COVID, that a lot of things can actually be done online. Now, whether it's virtual meetings like what we're doing now, or healthcare. But I think one thing that's quite unique with healthcare that is very different than all the other sectors that's been disrupted by the internet is that healthcare, there's still a huge portion of the services that needs to be done offline. Whether you just need to do a simple vital check or you need to draw blood, get a vaccine, it is still not that easily done at home. And so that's why we keep talking about, whenever we talk about healthcare, we never talk about purely online healthcare. We always talk about how do you leverage technology or leverage online to make the whole healthcare service better, right? So that integration of the online to offline, and more as we continue to advance in technology. So just by seeing a doctor online do a video, how much can you really solve? Is it 10%, 15% of your healthcare needs? And over time, as we have more advanced hardware or things that can collect more vital, can you move that 15% to 20, 25%? So that's kind of how I look at it. And I think the other telemedicine that we always focus on in terms of functionality is really on a few key things. I think chronic disease works very well because you already have certain chronic disease that requires frequent touch points. And so that from a telemedicine or online consultation works very well. We also see revisits works very well. You've seen doctor offline 3 days later after taking a medicine, still not feeling well. Then having a revisit, do an online consultation actually works very well. And then if you think about second opinion, you see a primary care doctor and maybe you want to talk to a specialist. So rather than the current process flow up, you have to get a referral, make an appointment and whatnot. Potentially you can just do a second opinion directly with a primary care provider as well. And so we see those as very, very good telemedicine in terms of usage as well as functionality.
That is interesting. I think, Donald, you can share with us about the Ping On Good Doctors experience when Jeff mentioned about the WeDoctor, and how to use technology to provide the comprehensive healthcare system.
First of all, the public has a lot of medical related questions and needs answers, and that's actually how Ping On Good Doctors started. But it has evolved from an online sort of doctor knows, doctor answers, to adopting the family doctor concept of providing comprehensive, continuous, holistic, person-centered, safe and quality care. And I've been privileged to be involved as their advisor in this transformation. The newly transformed and enhanced role of these upgraded internet doctors can now promote prevention, early diagnosis, triage, appropriate referral, as well as provide continuous long-term care. And of course, there needs to be a backup service with clinics behind, not just online. So the online-offline cooperation is very, very important, vital for safe practice. At Ping On Good Doctors, artificial intelligence actually has played a very big role in providing broader knowledge base, quality assurance, and safety checks. And since the beginning, AI has been doing a lot of work there. Digital health is a good alternative during challenging times such as COVID, when physical encounter is difficult or even hazardous. Ping On Good Doctors and other internet medical service providers have proven the value and has been recognized by the Chinese government. Digital consultations can mitigate and prevent overcrowding at emergency departments, urgent care clinics, and primary care clinics while providing the reassurance and guidance that patients are seeking. And the growth rate of internet consultations, for example, by Ping On Good Doctors is a good example, now at almost 1 million consultations a day. The ongoing healthcare needs of patients with chronic diseases, as mentioned, can be addressed by these internet family doctors. But just a little bit more is that even specialty care to patients in areas without access can be provided. Examples such as diagnostic image interpretation, data collection, and analysis. And these are provided, for example, by Ping On Good Doctors.
Thank you.
That's all.
Yeah, thank you. I think healthtech is a very important part when we talk about digital health. So Grace, how does healthtech play an important role in this ecosystem?
So insurtechs work with or become the stakeholder in the ecosystem that pays the bills. You know, they're the payers. So the solution of insurtechs, I believe, must address the real pain points of the end user by achieving, I think, several of these three main value add areas. One is bringing down the cost. Two is delighting the customer. And three is improving the patient outcomes. And so if you take, for example, what we do at my company at DocDoc, you know, we built an AI-powered digital health ecosystem that delivers doctor discovery, telemedicine, and primary care in-person bookings across Asia's largest network of doctors. And when we collect hundreds of data points on a per doctor basis and then house it in our infrastructure, so then the algorithms are then able to match patients' unique needs to the doctor's unique expertise based on the outcomes, price, and experience markers at a procedure and condition level of granularity, then the patient wins. And so when the patients are making these data-informed decisions, we know from experience that the costs drop significantly, outcomes improve by a meaningful margin, and the patient has a much better overall experience. And so overall, I think the entire health ecosystem benefits when these happen.
Yeah, I agree. Roberta, so what is your view in terms of the digital health? Does your company or your hospital also have any plans to broaden the services to telemedicine?
Absolutely. From the beginning, one of the basic values of our system was to bring integrated and continuous care to patients. So whereas we started with a network of primary care clinics, acute care hospitals, rehabilitation centers, and home health, we early realized that bringing that continuity of care into the patient's home in a more convenient way online was very, very important. So we started off by helping the patient with the patient portal, making it easy for them to be in close contact with their physician, make appointments, see their labs, port their diagnosis and images offline. But now we're increasingly encouraging our patients when necessary to access care in an online way. So this was greatly accelerated during the COVID-19 outbreak. We had hundreds of physicians extending the care beyond our normal patient base by providing free consultations to anybody that needed them during the COVID period. So we reached thousands of patients that way, many of them new to our system. And in fact, in keeping with this importance of integration of care, 8% of those online patients that were new to our system converted to offline patients. So they came into the clinic for actual consultations. And I think that's really, really an essential part of good medicine. So an online system is always nice, but where it's fragmented from the continuity of offline care, which is essential to many disease states, it's probably not as good. In addition, we've leveraged these amazing online platforms. We do it all the time, but in a more intensive way during the COVID outbreak. So we worked together with platforms, Tencent, TikTok, and reached millions of people with medical education that were necessary during the COVID outbreak. Being able to give them the knowledge they needed to stay safe, but also asking them questions and being able to answer questions about disease states that maybe they would ordinarily take to their normal providers, but because of the COVID outbreak, didn't have access to their normal providers. So one more point that I want to make about that is that one very, very important thing during outbreaks like we've just seen is to be able to ensure all patients to be able to get access to health care when it's, especially including when it's not related to the current epidemic. So by keeping certain hospitals safe from nosocomial infections and making sure the infection regimes are appropriate, it allows the healthcare system to continue to be able to care for patients that have less access because hospitals have either been closed because of internal outbreaks or because the government didn't think their infection control policies were good enough. So one of the roles that we were very proud to play during the epidemic was not only to be able to handle certain issues online through digital means, but also to be able to stay available to people that were having heart attacks, that couldn't get continued care from their cancer treatment, that were having strokes and just couldn't get out of original facilities. So this, be it digital or be it in person, being able to be continually available to patients in a non-fragmented way, making use of all modalities, including digital, including clinics, including hospitals, just so important.
In terms of the capital allocation, we see that the money has been inclined to this healthcare sector. So Jeff, do you expect this trend will continue? And what is the future investment trend in this sector, AI, data?
Yeah, no, I think especially what's happening globally, people have realized that whether you call it digital health or online healthcare is an important sector and it's here to stay. I think you are seeing people start to think about how do we leverage technology to really solve people's needs, right? And I think whether that is AI, whether that's data, because I think more and more we're going to move from more of a one-size-fits-all healthcare services to very, very much focus on individualized healthcare services. What that means is it's going to be shift away from let me fix you when you're sick to really let me continue to help you be healthy, whether that is wellness program, whether that's prevention, but how do you use data to provide tailored, individualized services to each other, to your users? And I think that's where data comes as quite important. We have seen an influx of investor interest in online healthcare services company or integrated healthcare services company, whether that's guys like Fullerton or even United Health. So we have seen a lot of these, and I do think this is a trend that will continue because there's still digital health or online health is still at the very early stage, if you ask me. There are still very fragmented with multiple players in different type of vertical. And so I do think there is a huge opportunity in terms of from the capital market perspective.
Yeah. So Donald, do you have any views?
I was going to add, besides we always focus on digital health, internet, but there's something we should think about from a business opportunity is self-care products, because we always promote patients to be responsible for their own health. And there are many products now, for example, that link to smartphones and all that to measure your blood pressure, your blood sugar. And even recently, there have been kits to look at antibodies for the COVID-19, although it's controversial. But still, a lot of things that people can do themselves. I think this becomes a business opportunity. Things in the past like even pregnancy tests, ovulation, and then the latest is cancer screening. Even from stool samples, one can look at possibility. So all this, I think, is something. It's part of the principle of promoting our responsibility for one's own health and to be able to take care. And I think that this is another market that may be evolving in the future.
Mm-hmm. But how to ensure the safety and quality of the digital health? Donald, do you have?
Yeah. I think the most important is really setting standards and then accreditation, and then also a matter of ethics, integrity, all these. But we need, I think, organize. For example, Wonka, my organization, does accreditation for digital health, and we started a pilot project because the safety issue is really quite important. Whether you have the backup service and whether you have things to check to make sure that you're not missing, for example, a heart attack on the internet. So again, I think we should have an international consensus, basically. There needs to be further work as to what are the basic standards. And then you need an accrediting body to make sure that everything is checked and all that. And I think, and also the continuation, the comprehensiveness of the program. So I think the way forward, first of all, there's the consensus, the awareness, and also ethical and even legal aspect. And also the commercial aspects. There are a lot of sort of vendors, agents that promote these kind of services. I think all these need to be somewhat regulated, or at least there should be a system intact to make sure that there's ethical practice. Yeah.
So I believe we all believe that digital health is the trend in future. So Grace, what is needed to sustain this digital health momentum?
Yes, I believe that it is digital health's moment, carpe diem, because during this COVID period, patients are expecting it now. And to me, reimagining healthcare is one that patients are empowered to make data-informed decisions throughout their health journey. And as Dr. Donald had mentioned as well, I agree, regulatory reform is going to be important for areas such as telemedicine, e-pharmacy. I see some of the questions coming through exactly, addressing this, is that we need to have clarity while keeping up with the needs on the ground, such that it doesn't stifle innovation, and ensure that data flows through the system, but ultimately to protect the patient in the process. This is really important. And then once this happens, I think we will see great gains in efficiency and access. To your question about, what's, the momentum, I don't think that we should fear a standstill. In my space, if incumbents choose not to make meaningful transformations to bring value to patients, or perhaps not move fast enough, I believe other adjacencies will step in and work with us in our ecosystem. And this is already happening as newcomers are starting to compete, especially in the insurance industry, and take market share and otherwise fulfill the customer needs.
Okay, thank you. So because of the time constraints, let's start taking questions from the audience. That is one interesting question. Is about what is the ideal business model for the telemedicine company in terms of payment subscription. So any panelists want to share their view? Jeff?
Why don't I start? No, so I think my experience is that pure telemedicine is not as easy as a standalone service. And the reason I'm saying this is very much so that if you think about the amount of needs that you can solve for in terms of healthcare journey, I think as of today, it is probably still fairly limited. And so without the whole integration of the online to the offline, can you really make it as a long-lasting standalone business model? Now, if you ask me, we have to shift, and I think the trend is that we're shifting from a fee for service, meaning every time you're sick, we fix you, to really more what do you call a membership base, or it's almost like a quasi-insurance base, where it's about making you healthier so you see doctor less. So the incentive between the care provider as well as the users is aligned, right? It's no longer about maybe you come for more, you do more tests. It's about let's keep you healthier, let's keep you focused on prevention. Holistic health is how I think about it. So I think that new care model, kind of membership base, is really the trend, and it will be kind of what people will focus on or want in the future.
Thank you.
Yeah.
Roberta?
Yes,
Sorry.
I can agree with Jeff more. It's definitely, I think, the way of the future because it is the right way. Healthcare's goal is to keep people healthy and bring them back to health when they're ill. So for almost 4 years, we've been working with a model where we get payment up front for preventive and proactive care. And when we combine that with online services and are able to help chronic disease sufferers with online support to their care, we find that we're able to reduce their symptoms and illness, be it diabetes or hypertension, that we're able to keep them healthy by combining that online, offline, continuous care. And if you ask for ideal, I think that is the ideal model, where somebody is willing to pay up front for that proactive preventive care and also the monitoring of it and help with their chronic disease, and also insurance against acute disease. So whether it's online or offline, I think that's the right model. That having been said, it's not the only potentially successful model, and people should have the opportunity to benefit from online services, even if they're not part of a larger community. And hopefully through that experience, they'll be motivated to care for their health in a more holistic way by buying such an insurance policy or joining such a membership program.
Certainly, just a few words. Certainly, it should be a component. Telemedicine is a component of quality whole person care. It's just a more efficient way that we're getting used to. And I agree, the continuity is the most important. So the business model should be like a membership. For example, Ping An Good Doctors has started this, the family doctor sort of membership at a low fee. And it's in line with Chinese government policy of the contract system, promoting individual one family doctor for each person. So this also, I think the availability of telemedicine will make this much more efficient and accessible. So I think we cannot have pure telemedicine. Nothing can replace the physical contact, but then it will become more and more important component as part of the services that people will begin to expect.
Just for your information, Donald is also a senior advisor to Ping An Good Doctor. That's another questions. Also, I want to ask Roberta. So when Beijing faced the second wave of COVID-19, it took just 2 or 3 weeks to put them under control. So how did they do that? And what are the challenges, including the primary care system, that China is facing in future?
Well, thank you. As I said, I was extremely impressed with the quick response from the government on setting up systems to get the virus under control in Beijing. And I think that the key components of it was quickly inspecting all healthcare facilities to make sure they were up to the task of dealing with infections should they come in the door. And if a healthcare facility got an infection, it would quickly be closed off from the rest of the ecosystem. That's number one. Number two, setting up testing and making testing as available as possible to as many people as possible. Also, when somebody showed up with symptoms, and they were quickly segregated into the place where those symptoms would be evaluated and tested. And that person was not able to go into society or into the rest of the healthcare system until 2 tests came back negative. So quick testing responses. And then if there was a positive test result, incredible tracing. And that tracing just got better as time went on with our health kit apps. Somebody said at the start of our pre-meeting, where are you? I'm in Shenzhen. I've been traveling. I was in Guangzhou yesterday, Shanghai last week. And it's possible to travel in China and to feel safe, because when we travel, we have tracing of where we've been. We know that everybody else on that airplane hasn't been to a place that there's been an outbreak. Of course, nothing is 100%, but the tracing system in China and using technology for that tracing has been, I think, an amazing lifesaver. So challenges going forward, the world will, well, first, the most immediate challenge is that the rest of the world hasn't figured out how to control the virus. And unfortunately, having our borders closed is not good for anybody, not good for Chinese economy, not good for the world economy, period. So until we figure it out, until there's a vaccine, and I believe there will be a vaccine soon enough. I think that there's so many development projects going on that will develop multiple vaccines. The question I have and the concern that I have, and it's a concern for China and the rest of the world, is will we be able to coordinate distribution of the vaccine so that we will be able to confidently believe that people all over the world have access, and then borders can be confidently opened. So that's the kind of global concern that I have. The concern for China going forward is we still have an incredibly quickly aging population, 600 million over the age of 60 in the very near future. We have 260 million people diagnosed with chronic diseases. 86% of the deaths are caused by chronic disease sufferers. 3.9 million people are diagnosed with cancer every year. And we have almost 100% bed utilization rate in tier 3 hospitals. So if you ask me, is the answer to build more hospitals? I say no. The answer is to get better primary care and care.
Yeah, thank you so much. Thank you for the discussion. Please allow me to round up this webinar. It may be too early to say that we are in the post-COVID-19 era, but the discussion from all the experts told us that technology will play a very important role. Many thanks to all the panelists, the audience, on behalf of South China Morning Post and Milken Institute Asia Center. So this is real, but this is the first of the 3 webinars of our Asia Impact Series. So in the next 2, we will zoom in employment and corporate governance issues in the region. Thank you for joining. Thanks all. Bye-bye.